Now, uBlog's Kevin LaHood Burns says what he thinks are the pros and cons of medical marijuana.
Well, I voted this week and I noticed there was a green initiative on the ballot. No, I'm not talking an environmental issue. Initiative 13 proposes that the drug marijuana be legalized for medicinal purposes. Looks like I'm finally going to have to start taking advantage of our student health services. Just kidding. It's doubtful that the initiative will pass, which in my opinion is too bad. The mild risks seem to be even less of a deal when considering the benefits for patients with cancer, AIDS, and glaucoma. In addition, we see that the effects might help those with digestive disorders like IBS and assist people battling addictions to more destructive drugs like opiates and alcohol. Okay, I'm not completely nuts. There are obvious risks. Regulation becomes rather difficult when someone grabs an ounce of turquoise orangutan sunset on doctor's orders. We have seen this alarming trend with other prescription meds, such as Adderall and Vicodin. Abuse of these synthetic drugs, similar to methamphetamine and heroin, is on the rise, and seemingly without the baffling attention awarded to cannabis. Of course, the pharmaceutical companies will figure this one out, I'm sure. They seem to have our best interests in mind. So, as we discuss whether or not a person with cancer should be allowed to use marijuana to mitigate the harsh nausea, citizens in California are trying to decide whether or not they're going to legalize it outright for recreation and taxation. Sounds like somebody finally wants to reap some benefits from that one coworker who's late for work again because of an after-midnight excursion with a Pink Floyd album, The Wizard of Oz, and a bag of Doritos. For uBlog, I'm Kevin LaHood Burns.
Thanks, Kevin.